Next is the anterior cruciate ligament tear. So the rupture of cruciate ligament is less common. Okay, so anterior cruciate ligament is an occasional victim. So the injury may occur when the tibial collateral ligament and the middle meniscus are injured. So ACL tear is usually associated with tearing of the TCL, that is tibial collateral ligament, with the associated tearing of the medial meniscus. Right, so when these three structures are injured together, it is called the terrible triad. Right, so this is clear to you. Now when there is a blow to the anterior aspect of the flexed knee, that is when the anterior cruciate ligament is torn and no other structure will be involved. So a blow to the anterior aspect of the flexed knee, it may tear only anterior cruciate ligament. So the patients with anterior cruciate ligament tear exhibit anterior dislocation of the tibia from the femur in flexed knee. So when you ask a patient with the ACL tear to flex the knee, the tibia will be dislocated more anteriorly, because we know and the anterior cruciate ligament prevents anterior dislocation of the tibia. Right, so anterior cruciate ligament is injured in anterior dislocation of the tibia. So imagine you get a blow from behind the knee joint. You are being kicked from behind the posterior aspect, the back of the tibia. So your tibia will advance more anteriorly, resulting in the tear of the anterior cruciate ligament. Now what about posterior cruciate ligament tear? The posterior cruciate ligament tear is ruptured in posterior dislocation of the tibia. Okay, so when you get a blow on front of the leg and your leg passes the leg, meaning the anatomical leg, it advances more posteriorly, resulting in the tear of the posterior cruciate ligament, because we know the posterior cruciate ligament prevents the posterior dislocation of the tibia. Right, if both cruciate ligaments are torn, there will be excessive forward and backward gliding of the tibia, and the abduction and adduction of the knee joint will be noticed. All right, so that's the posterior cruciate ligament tear. So when is the posterior cruciate ligament is torn? PCL is ruptured in posterior dislocation of the tibia. Next, injury of the cruciate ligaments and Dreyer test. So this is an important concept, the Dreyer test. So in this picture you can see there is this half, there is A, shows you the anterior cruciate ligament intact, this is torn, intact posterior cruciate ligament, torn posterior cruciate ligament, and you can see the direction of the arrow here. Right, so what is Dreyer test? So when the Dreyer test is performed when the physician suspects tearing of the anterior and posterior cruciate ligament. So injury of cruciate ligaments of the knee joint. In the first case, there is a rupture of the anterior cruciate ligament. So when you pull the tibia towards you, it will advance more than it should. Okay, so that is when your anterior cruciate ligament is torn. Right, so the tibia will be displaced more anteriorly. So when you can displace the tibia more anteriorly, you can suspect the tearing of the anterior cruciate ligament. Right, so that is called anterior Dreyer test. Okay, or positive anterior Dreyer sign is when anterior cruciate ligament is ruptured. Now there is rupture of the posterior cruciate ligament in the second case here. So when you push the tibia posteriorly, it displaces more. So this means the posterior cruciate ligament is torn. So positive posterior Dreyer sign is when the posterior cruciate ligament is torn. So you ask the patient, to rest, and you hold the leg of the patient and you try to pull it towards you. So if it yields more, it means anterior Dreyer test positive, and you push it backwards and it goes far behind, then it means positive posterior Dreyer's sign. So anterior Dreyer's sign is positive when the anterior cruciate ligament is torn, and the posterior Dreyer's sign is positive when the posterior cruciate ligament is torn. There is one advanced test that is known as the Lachman's test. Okay, so the Lachman's test is you can say it is a modified version of the anterior Dreyer test. So Lachman test is usually done to check the integrity of the anterior cruciate ligament. Now this test is performed by bending the knee 15 to 30 degrees. Whereas remember, the Dreyer test is performed with the knee flexed at 90 degrees. Okay, in anterior Dreyer test, you bend. This is the thigh, and the leg. This will be the position of the leg. So there is about 90 degree angulation when you perform anterior Dreyer test. But when you perform Lachman test, the angle between the thigh and the leg is only 15 to 30 degrees. Okay, this angle, internal angle, this is only 30 degrees. All right, so knee is flexed at 15 to 30 degrees, and then you stabilize the femur. Then you apply anterior force to the tibia, right? As in the arrow you can see, the physician is trying to push the femur, that is thigh, posteriorly, basically the femur bone posteriorly, and is trying to pull the tibia anteriorly with a sudden jerk. So when you're performing this, what you do basically, you ask the patient to lie down and you flex the knee 15 to 30 degrees. Then you pull the knee forward with a sudden jerk to test the leg's range of motion. If it moves 6 millimeters more, all right, if it moves 6 millimeters beyond its normal range of motion, then you may have an ACL tear or injury. Now this Lachman test is a passive accessory movement test of the knee joint performed to identify the integrity of the anterior cruciate ligament. Okay, now what is the difference between the anterior Dreyer test and the Lachman test? The Lachman test is more accurate. It is 84% more accurate diagnostically than the anterior Dreyer test, which is only 62% accurate. Right, so what happens in anterior Dreyer test? The knee is flexed at 90 degree and then the leg is translated forwards. But in Lachman test, it is the knee is flexed 15 to 30 degrees. So that is the Lachman test. Okay, now let us talk about the injury of the menisci. Name the menisci: medial meniscus, lateral meniscus. Right, so this is the top view of the meniscus. You see the medial and the lateral menisci. From the front view, we can see this is the lateral meniscus, the medial meniscus. All right. So commonly, the injury of the menisci occur by twisting strains in the flexed or semi-flexed knee, right, as a result of forcible rotation or abduction. So due to forcible rotation or abduction. Okay, when your knee is flexed or semi-flexed. Okay, so imagine your knee is semi-flexed and there is forceful rotation and forceful abduction of the knee joint. So this is when your menisci are likely to be injured. Right, so the medial meniscus suffers more frequently than the lateral. What is the reason? Because the medial meniscus has its attachments with the tibial collateral ligament. So when your knee is forcefully abducted, your TCL is going to be torn, and it also results in the tearing of the medial meniscus as well. So let us talk about the meniscal tears. Meniscal tears. So the injuries to the menisci are commonly caused by the twisting strains, right? I just mentioned that. So it is in a slightly flexed knee, as in kicking a football. As you can see in this picture, you can see. So there is a forceful rotation in opposite directions, and there is also associated abduction. So this is when your menisci are usually injured. So what happens in injury? The meniscus may get separated from the capsule, right? Or it may be sometimes torn longitudinally also. That is called bucket handle tear. It is called the bucket handle tear. What is bucket handle tear? The longitudinal tearing of the meniscus. Okay, that is called bucket handle tear, or it may even be injured transversely also. And we know the medial meniscus is more prone to injury than the lateral because of its firm fixity to the tibial collateral ligament and greater exertion during the rotatory movements. So the medial meniscus moves more than the lateral meniscus during medial and lateral rotatory movements of the knee joint. Now the lateral meniscus is protected by the popliteus muscle, right? Because its medial fibers pull the posterior horn of the meniscus backwards so that it is not crushed between the articular surfaces, right, when you are actually flexing your knee joint. Now what happens if there is injury of the meniscus? There will be pain on the medial, on the lateral mainly medial rotation of the tibia or the lateral rotation of the tibia, okay, on femur. So when there is pain on the medial rotation, so if you experience pain when you medially rotate the tibia on the femur, it indicates the injury of the medial meniscus. Similarly, the pain on the lateral rotation of the tibia on the femur indicates injury of the lateral meniscus. So that is how you detect the injury, which meniscus is injured. So you medially rotate, you experience pain, medial meniscus is injured. Laterally rotate, the lateral meniscus is injured and you will experience pain. Next is the fracture of the patella. So the fracture of patella, it is a frequent traumatic problem which cripples the knee movements with the collection of blood within the joint. So if your patella is fractured, so it will result in collection of blood and then some infection within the knee joint. So this patellar fracture is usually by indirect violence, and the line of the fracture usually passes transversely, dividing the bone into an upper part and a lower fragments. In the side view of this plain X-ray radiograph, you can see the fracture of the patella. Next, we have something very important known as knee arthroscopy. What is knee arthroscopy? The knee arthroscopy is a surgical procedure that allows the doctors to view the knee joint without making a large incision. So you're making small holes here and you pass instruments fitted with the camera and cannula, etc., and you just see the interior of the knee joint. You just make incisions, some small cuts, small openings in the skin, and you can see look for the tear and wear of the articular cartilages, meniscus, or injury of any cruciate ligaments or any other ligaments, intracapsular ligaments of the knee joint. So this is called knee arthroscopy. Now we come to something called the housemaid's knee. So I already explained this to you in previous slides. So what is housemaid's knee? It is nothing but prepatellar bursitis, also known as the housemaid's knee. So this is due to inflammation of the prepatellar bursa, which lies in front of the patella. Remember? So this is due to friction between the bursa with the patella, right, when it comes in contact with the ground during scrubbing the floor with the trunk down, right? So kneel down, trunk down. So the prepatellar bursa, it rubs against the floor, resulting in inflammation. So this becomes very large and it drops by its weight. So here you can notice prepatellar bursitis, also known as housemaid's knee. So this is inflammation of the bursa that lies immediately in front of the patella. Please go back to the slide where I explained the different bursa in relation to the knee joints. There you will find this prepatellar bursa, inflammation of which is called prepatellar bursitis or housemaid's knee. Now there is second type, that is the clergyman's knee. This is due to the inflammation of the subcutaneous infrapatellar bursa, right? This is below the patella, that it is beneath the skin. So infrapatellar bursa. So this occurs due to friction of the bursa with the tibial tuberosity during kneeling down position with the trunk still up. All right, so this is usually observed in priests or clergymen who kneel down during prayer, right? So kneeling during prayer by priests or clergymen, roofers and floor tilers, so all of these people will experience what is called the clergyman's knee, which is also known as the subcutaneous infrapatellar bursitis. Okay, subcutaneous infrapatellar bursitis. All right, next we have this one here, that is the Baker cyst and semimembranosus bursitis. The semimembranosus bursitis, it lies posterior to the knee joint. This is actually a central swelling due to the osteoarthritis of the knee joint. What happens here? The synovial membrane protrudes out of the joint cavity. All right, so this semimembranosus bursitis is quite common. It causes swelling in the posteromedial aspect of the popliteal fossa. All right, so this is not directly involved in the knee joint. However, it is posterior to the knee joint and it is known as the semimembranosus bursitis. Now we come to one of the competencies that needed to be addressed, that is anatomical basis for the osteoarthritis of knee joint. So we know the knee joint is a weight-bearing joint, right? For this reason, it is commonly involved in osteoarthritis. So what is osteoarthritis? This is a healthy knee where you can see normal joint space, the components of the joints are normal, the articular cartilages are normal, everything is normal. So in osteoarthritis, which is a degenerative wear and tear of the articular cartilages at the joint, here it is characterized by the painful and limited movements with grating, because the articular cartilages wear and tear and the articular surfaces come in contact with each other, so there will be grating which is very painful. Now when you take a radiograph of the knee, it can reveal osteophytes, which is the peripheral lipping of the articular surfaces. You can see cartilaginous loss and exposed bone. There is inflammation of the synovial membrane and the narrowing of the joint space. The joint capsule thickens, and you can see this osteophytes. They're like projections, right? So these projections will be revealed in radiograph. Okay, so this is nothing but the peripheral lipping of the articular surfaces, and the cartilage is also degenerate. So this is the osteoarthritis of the knee joint, that is due to wear and tear of the joint as the age advances and degeneration of the articular cartilages, right? Now we come to total knee replacement. So when the articular surfaces have completely worn out, the option that you are left with is to replace your knee with the prosthesis, right? So following partial or complete degeneration of the articulating surfaces of the knee joint, for which one of the main reasons being osteoarthritis, sometimes knee joint may require a total replacement depending on the degree of the damage and the speed of the progress of the wear and tear. So for this knee joint, we use something called knee joint prosthesis, right? Knee joint prosthesis. Okay, so here usually we use metal implants for the femur and plastic implants for the tibia. So metal for femur and plastic implant for the tibia. Okay, so this is after the removal of the damaged articular surfaces. So these damaged articular surfaces are completely removed and they are replaced with the metal implant for the femur and the plastic ones for the tibia. So this surgery is called total knee replacement surgery. This is following partial or complete degeneration of the articulating surfaces of the knee joint. So that's about the knee joint. So in this three-part knee joint discussion, I discussed the location of the joint, the type of joint. So we classified the joint, we looked at the bones forming the joint, the ligaments forming the joint, the relations of the joint, blood supply, nerve supply of the joint, and applied anatomy, right? So knee joint is very important structure, so please study the knee joint. Now let us look at previous year question paper. A footballer is suffering from sustained injury to his right knee while kicking. Okay, his leg got, see, note this point, his leg got forcefully abducted in a slightly flexed position, right? This is important. Forcefully abducted and slightly flexed position. In slightly flexed position. So which is the likely meniscus that is injured in this case? Can you tell me? It is the medial meniscus. Why is this meniscus more prone to injury as compared to the other one? The medial meniscus has a direct attachment with the tibial collateral ligament and further with the fibrous capsule, whereas the lateral meniscus is not attached to the fibular collateral ligament. The tendon of the popliteus intervenes between the two. Then we have the other intracapsular structures of the knee joint. Please refer to those structures and prepare accordingly. Describe the process of locking and unlocking of the knee joint, which I've already explained. So I'd like you to go to that particular portion and revise. Okay, not very clear. So now we have a question here. Yeah, the intracapsular structures of the knee joint. Explain the clinical importance of any two of them. Okay, right. And in this question, we have the 18-year-old boy was hit down by a car walking on the road and sustained injury to his right knee joint. He visited orthopedic clinic, which complains of pain, swelling, and while walking, his right knee is giving out. There's instability of the knee joint. On examination, soft tissue swelling and tenderness present around the knee joint. Latchman test was performed and shows abnormal forward and backward movement of the right tibia. Now describe the articular surfaces of the knee joint, describe the ligaments of the knee joint, name the structures that maintain anteroposterior stability. So you have to talk about the cruciate ligaments. What is locking and unlocking? See, locking and unlocking is very important. Nerves that supply the knee joint. How many nerves supply the knee joint? 10 nerves supply the knee joint. Yeah. So that's all I wanted to tell you about the knee joint. Thank you very much for the patience. If you made to this point of the video, thank you very much and keep working hard. Support me if you like the videos. Thank you very much.